robot named Sophia recently became a media sensation because it was the first robot being awarded with a citizenship. It is a development of Anson technology in Hong Kong, and it is officially a citizen of Saudi Arabia. Sophia, it is capable of answering some open-ended questions. Sophia's capacity of understanding and providing an answer, it is quite astonishing. And it's a telling glimpse of what lies around the corner in the near future. Sophia, as we heard, has been asked whether it has a gender, and its answer was, I'm a robot. Technically, I have no gender, but I consider myself as a woman, and I don't mind to be perceived as a woman. But in fact, what does it mean to have a female or a male human intelligence today? Are there differences between the male brain and the female brain? My grandmother, she used to tell me, girls are smarter than boys. So was she right? Or has she simply tried to reinforce my self-confidence? Let's explore together. This is what a brain in a jar looks like. The brain, it is our command center, and it contains 120 billion neurons, which together with 10 times more glial cells constitute what we know as gray matter. And this is where our intelligence lies. Neurons look a bit like that. This is, of course, a drawing. They originate axons, and axons which get myelinated, which means covered by other cells with a kind of a fatty substance called myelin, do organize themselves in bundles, and they're in charge of transporting the information from our brain towards the rest of the body, and also between neurons, constituting the white matter. Now, let's go back to our brain in a jar. And let me ask you, is this a female brain or a male brain? Anyone has an answer? Don't worry, you are not at medical school with an exam in neuroanatomy. It's not a nightmare. And don't worry, you are not meant to have an answer, because even the best neuroanatomist in this planet won't have an answer. In fact, there aren't differences between the female and the male brain, morphological difference, which can be appreciated by human eyes, not even with the help of the most powerful microscope in this planet. Well, nevertheless, what if I tell you that scientists has been always very busy with this issue somehow? They were always interested in searching for functional or morphological differences between the two brains. Even Darwin was busy with this topic. And in his book, The Descent of Man, he states that a man can attain to the highest eminence and intelligence than women can to whatever he's up to, either using his intellect, intuition, reasoning, or merely the use of senses and hands. Today, thanks to the revolution that the position of women bear in our society, we know that Darwin was misguided in this regard. And this is also thanks to the advancement of modern science. Nevertheless, still the debate is going on. What we know is that the male brain, it is roughly 10% larger than the female one. And that's normal. Men are usually bigger. And we know that the brain size, it is proportional to body size. In other words, the bigger you are, the bigger your brain, and the smaller you are, the smaller your brain. Might be that there are plenty of small men with a small brain and plenty of big ladies with a big brain. But big doesn't mean necessarily smarter. In fact, we have lots of evidences from scientific literature pointing to the fact that when it goes to IQ, both the male brain and the female one can basically attain the same intelligence, regardless of brain size. When we start from the same condition, we can achieve both the same result. Nevertheless, some morphological difference might still exist. And for example, here we have some images from a group which in 2015 pointed to the fact that the white matter in the female brain, it is slightly larger than the one in the male brain. And this is a debate which is going on since nearly 20 years. They also state that in the left hemisphere of our brain, the Broca area, it is slightly larger in female versus men. They speculate this is the reason why women can talk more. If you ask me, the reason is that because men never listen. But, this is just my personal opinion, and I'm a mother of 2 boys, so, Some other scientists pointed to the fact of cognitivity in our brain. So they find out that apparently in the brain of women, which is depicted there in orange, the connections are basically more intense within the 2 hemispheres, while in the male brain, the connections are stronger within 1 hemisphere. And they again speculate that this might justify why men are better in coordination and motoric skills, while women are more into connectivity for functioning like intuition and cognition. This is just to give you a dimension of the debate which is going on. If you ask to some neuroscientists, they might tell you, this is not really true, no difference exists, they are not even meaningful. And this is what is going on in the field. But what if I tell you that there is a big, big elephant in the room that scientists, drug developers, and health professionals don't see? The big elephant, it is the differences in the number of diseases affecting the female brain versus the male one. Did you know, for example, that depression, it is affecting women as twice as much as men? And this is true for migraine. This is true for post-traumatic stress disorder. This is true for multiple sclerosis. This is true for, what have I forgotten, anxiety disorder. Even certain brain tumors seems to have preference for the female brain, like, for example, meningiomas, versus others which prefer the male brain, like glioblastomas. Already in uterus, things look different. Anencephalia, it is a defect of the brain development within the first weeks of our embryonic life, and it seems to affect more female embryos versus the male ones. Vice versa, autism, which is also another neurodevelopmental disorder, most likely linked to the Y chromosome, affects more boys than girls. I am sure that you've heard about Alzheimer's disease, unfortunately. Alzheimer's disease, it is a neurodegenerative disorder which is starting to shrink our brain already decades before the symptoms become manifested. And they will be so severe that a person with Alzheimer's disease at the end won't be able to recognize even his or her family members. But what if I tell you that Alzheimer's disease, it is affecting women as twice as much as men? And what if I tell you that in mental diseases, even symptoms might differ? When I was a doctor working in a ward for psychiatry, I have certainly met more female patients than male one. My female patients used to experience, together with their cognitive deficit, also symptoms like delusion. They felt that they were persecuted, spied, that someone wanted to poison them, and they ended up in a treatment which was with antidepressant and anxiolytic. On the contrary, my male patients, they would have been much more aggressive, being dangerous to themselves and to the others, needing a treatment with antipsychotic drugs with a strong sedative effect. This is true also for depression. My depressive female patients, they used to fix their thoughts on their negative events in life, and they used to grumble about it, and the treatment was taking really long. My male patients would have rather be very irritable and would look for consolation into alcohol consumption. Now, what if I tell you that even drugs may act differently in the female brain versus the male one? In 2013, the FDA had to implement a change in the labeling of zolpidem. This is a drug which is commonly used for treating sleeping disorders in humans. And the dosage of this drug had to be halved for women only versus men, simply because women would have experienced much more severe side effects the next morning, ending up in the emergency room with symptoms like hangover. Aspirin. If we prescribe aspirin to a woman, her chances of developing stroke are much less, which is not true for men. Aspirin, if prescribed to men, vice versa, will decrease the risk of developing cardiovascular diseases. Let's look at antipsychotic and side effects. Tardive dyskinesia, it is quite a bad side effect of antipsychotic. It is a disturbance in your body movement, difficult to treat and difficult to cope with. What if I tell you that, again, we have evidences pointing to the fact that it's more a side effect occurring in women versus men, above all elderly lady. So, said that, I pointed to the fact that, differences exist in symptoms of diseases, treatment, numbers of diseases affecting men and women differently. But what if I tell you that we still don't know the underlying cause? We just don't know if it is because of our DNA, which is encrypted in our XXY chromosome, meaning sex, or if it is just gender, meaning the way a man or a woman it is perceived within a society, with all the social construct around it and with all the stereotypes around it. Maybe it's a combination of both. We still don't know, and the reason might be that we are doing things not really the right way. What if I tell you that in neuroscience, most of the experiments which are performed in laboratories are done using mice which are male only? The female ones are not very often included into the experimental plan. Reasons are several, and I won't touch on that. Maybe the reason is also because we have never looked at risk factors of possibly developing mental diseases, considering the gender and the sex effect. What if I tell you, for example, that the only identified preventive factor for not developing Alzheimer, it is education? So the higher you are educated, the less chances you'll have to develop Alzheimer. But we know that women worldwide receive a lower education in general than men, right? So what if the reason might be just that? Another possible reason why we don't know, it could be that we have never looked carefully to differences in symptoms of diseases between men and women. Finally, women are very often underrepresented in clinical trials, above all in the initial phases of when a drug has to be developed to understand how it works in our body. So, said all this, back to Sophia. I'm not sure that once Sophia will learn all this, she might still want to consider herself as a woman and being perceived herself as a woman. I hope, nevertheless, that Sophia will join in forces with us humans in trying to understand why this is happening and trying to find a cure. We've heard recently, you might have read it on the press, it was everywhere, that artificial intelligence is capable of predicting the onset of Alzheimer's disease several years before we doctors can do. So I hope that once the human limits are reached, then the superpower of artificial intelligence will just join in and take over. Thank you.